2026. Oh, here we go. I'm making breakfast. Yeah. What's live right now? Oh. Sleep apnea cure? Yeah, right.
Can this one pill really make a difference? Obstructive sleep apnea is one of the most common sleep-related breathing disorders, yet millions of people either go untreated or struggle to use the treatments currently available. For years, CPAP therapy has been considered the gold standard, but not everyone can tolerate sleeping with a mask, tubing, and pressurized airflow every night. That is why new research on a once-nightly pill for sleep apnea is getting so much attention. Recent phase 3 trial data suggests that an investigational drug called AD109 may help reduce breathing interruptions and improve oxygen levels in people with obstructive sleep apnea. This is important because AD109 is not designed to work like CPAP. Instead of using air to splint the airway open, this medication targets the neuromuscular causes of airway collapse during sleep. To understand why this matters, we first need to take a closer look at what obstructive sleep apnea actually is. Obstructive sleep apnea, or OSA, occurs when the upper airway repeatedly narrows or collapses during sleep. When this happens, airflow is reduced or completely blocked, even though the person is still trying to breathe. These episodes can cause oxygen levels to drop, carbon dioxide levels to rise, and sleep to become fragmented as the body briefly wakes up to restore breathing. Over time, untreated sleep apnea can place significant stress on the body. Patients may experience loud snoring, gasping, or choking during sleep, morning headaches, daytime sleepiness, poor concentration, mood changes, and reduced quality of life.
Yes.
More importantly, OSA has been linked with serious health
That is
problems,
correct.
including high blood pressure, heart disease, stroke, metabolic dysfunction, and increased risk of accidents due to daytime fatigue. For many patients, CPAP therapy can be highly effective. CPAP stands for continuous positive airway pressure, and it works by delivering a steady flow of pressurized air through a mask to keep the airway open during sleep. When used consistently and correctly, CPAP can reduce apneas, improve oxygenation, restore sleep quality, and lower the risk of complications. The problem is adherence. Many patients find CPAP uncomfortable or difficult to use long term. Some struggle with mask leaks, dry mouth, nasal congestion, claustrophobia, skin irritation, pressure intolerance, or simply the inconvenience of wearing a device every night. As a result, a large number of patients either stop using CPAP or never start in the first place. This creates a major treatment gap in obstructive sleep apnea care. That is when AD109 becomes interesting. AD109 is an investigational once-nightly oral medication that combines two drugs, paroxybutynin and atomoxetine. These medications are designed to work together
Wouldn't
to
the
support
person
the
be able
muscles
to
of the
just
upper
like
airway and
expand
reduce
the
the tendency of
airway
the throat
like
to sag or collapse during
the
sleep.
nasal way?
This approach is different from traditional mechanical therapies because it targets the underlying neuromuscular drivers of airway obstruction. In other words, the goal is not just to force the airway open from the outside using pressure, but to improve the body's ability to maintain airway stability from within. During sleep, muscle tone naturally decreases. In people with obstructive sleep apnea, this reduction in muscle activity can make the airway more vulnerable to collapse. The tongue and surrounding soft tissues may fall backward, narrowing the airway and interrupting airflow. If a medication can help improve upper airway muscle activity during sleep, it may reduce the number of breathing interruptions and help maintain better oxygen levels. According to the phase 3 clinical trial data, AD109 showed promising results in patients with mild to severe obstructive sleep apnea who could not tolerate or refused CPAP therapy. The trial, called Synergy, enrolled 646 adults across 69 sites in the United States and Canada. Participants were followed for 6 months, giving researchers an opportunity to evaluate both effectiveness and safety over time. One of the key measurements used in sleep apnea research is the apnea-hypopnea index, often abbreviated as AHI. This measures the number of breathing interruptions per hour of sleep. An apnea is a complete pause in breathing, while a hypopnea is a partial reduction in airflow that is usually associated with oxygen desaturation or arousal from sleep. The higher the AHI, the more severe the sleep apnea. In the Synergy trial, patients taking AD109 had about a 44% reduction in breathing interruptions per hour. By comparison, patients in the placebo group had about an 18% reduction. This difference suggests that the medication had a meaningful effect beyond placebo alone. But sleep apnea is not just about the number of breathing interruptions. Oxygen levels also matter. When the airway collapses during sleep, oxygen saturation can fall repeatedly throughout the night. These repeated drops in oxygen can increase stress on the cardiovascular system and contribute to inflammation, sympathetic nervous system activation, and other harmful physiologic effects. The trial reported improvements in oxygen-related measurements as well, including oxygen desaturation index and hypoxic burden. Oxygen desaturation index refers to the number of times during sleep that blood oxygen levels drop. Hypoxic burden reflects the overall amount of oxygen deficiency experienced during the night. Improvements in these measurements suggest that patients taking AD109 not only had fewer breathing interruptions, but also experienced less oxygen deprivation. Another important finding was that more than 40% of patients saw their sleep apnea disease severity category improve. In addition, 18% achieved complete disease control. These results are especially notable because the study population included patients who were unable or unwilling to use CPAP, which represents a group that often has limited treatment options. The results were also reported across a broad range of patients, including those with different severity levels and body types. This is important because obstructive sleep apnea is not the same in every person. Some patients have mild disease, while others have severe disease. Some have obesity-related airway narrowing, while others may have anatomic or neuromuscular factors that contribute to air collapse. A treatment that shows benefit across different patient groups may have broader clinical potential. However, It is also important to be realistic. AD109 is still investigational, which means it is not yet approved for routine clinical use. AbnaMed has submitted a new drug application to the FDA, and the company expects a potential PDUFA target action date in the first quarter of 2027, depending on FDA acceptance of the application for review. Until the FDA completes its review, AD109 should be viewed as a promising investigational therapy rather than an available cure. It is also important to understand that the word cure should be used carefully. A medication that reduces breathing interruptions and improves oxygen levels may be very helpful, but obstructive sleep apnea is a complex condition. It can be influenced by anatomy, body weight, age, sleep position, alcohol use, medications, nasal obstruction, and other factors. Some patients may respond better than others, and long-term outcomes still need to be understood. For many patients, treatment may still require a combination of approaches. This could include CPAP, oral appliance therapy, positional therapy, weight management, surgery in selected cases, lifestyle changes, and possibly medications like AD109 if approved. The goal is not just to reduce snoring or improve one number on a sleep study. The goal is to improve breathing during sleep, protect oxygen levels, reduce symptoms, and lower long-term health risks. Safety is another major consideration. In the Synergy trial, AD109 was reported to have an acceptable safety profile, with side effects that were generally mild and expected. The most common side effects included dry mouth, nausea, insomnia, and difficulty urinating. These side effects make sense based on the medications involved, especially because eroxybutynin has anticholinergic properties. However, around 21% of patients discontinued therapy due to side effects. That is not a small number. It means that while AD109 may be easier for some patients than CPAP, it may not be tolerated by everyone. Any medication that affects the nervous system or muscle tone must be evaluated carefully, especially in patients with other medical conditions or those taking multiple medications. This is why FDA review, additional research, and real-world data will be important. Clinical trials provide essential information, but once a therapy is used more broadly, clinicians learn more about which patients benefit most, which patients are at higher risk for side effects, and how the treatment fits into everyday sleep medicine practice. From a respiratory care perspective, AD109 is exciting because it reflects a shift in how obstructive sleep apnea is being understood. For a long time, obstructive sleep apnea has mainly been treated as a mechanical airway problem. The airway collapses, so we use pressure, devices, or surgery to keep it open. But research continues to show that OSA also has important physiologic and neuromuscular components. This means future treatment may become more personalized. Instead of assuming every patient needs the same approach, clinicians may eventually choose therapy based on the patient's specific disease mechanism. One patient may do best with CPAP, another may benefit from an oral appliance, another may need weight loss, positional therapy, or surgery. And some patients may eventually be candidates for pharmacologic therapy that targets upper airway muscle control. This could be especially
Hello. Okie dokie. I'm all done. I'll do a sleep stream tonight. And I don't know if I'm doing any other streams between then and now. So thank you for liking, commenting, and subscribing. Especially thank you for commenting because it gives me something to work with. Mm-hmm. Thank you for joining. See you comments in the next stream. Bye.